and welcome to another episode of Health and Wellness. I'm your host, Karima Williams, and today I'm here in Marlton, New Jersey at the Rothman Institute. And today we're speaking with Dr. Rob Franks, an orthopedic surgeon. Welcome, Dr. Franks.
Thanks, Karima. It's a pleasure to be here this evening. I appreciate your having me. The Rothman Institute has two urgent care centers at present. We have one in Limerick, Pennsylvania, and we have one in Marlton, New Jersey. I'm one of the physicians who works in the Marlton facility. We have several physicians who all rotate through the facility. The purpose of urgent care is to provide exactly that, urgent care for orthopedic and sports injuries. It's a very convenient level of care for patients because it gives them the ability to be seen quickly and accurately perform orthopedic physical examination as well as radiological testing. So we know pretty much immediately whether someone has a broken bone or a significant sprain, significant strain, or worse, something that immediately needs to be transferred to the emergency room for more emergent care. It's especially good for our athletes. If we have an athlete who is injured at practice or is injured at a game, we're able to urgently get them here into the clinic. We're able to do a good physical exam on them, get a good history. We're able to do radiological studies right away, and we can determine, yes, this ankle is fractured, no, this ankle is not fractured. And the reason that makes a difference is if we know right away that we can eliminate fracture, we can start somebody in rehabilitation right away and try to get them back into their sport quicker. If we know that there is a fracture present, then we can go ahead and we can treat accordingly, cast, boot, or surgery if it comes to that. We have several physicians who are part of the Rothman Institute here in Marlton who basically practice all facets of orthopedic surgery at one time, on one day or another, I should say, here at the Rothman Institute. Where our surgeries are done are dependent upon which physician you see. We have facilities here to do ultrasound-guided injections. We have facilities here to do epidural injections. We have basic in-office procedures that we can do, but actual surgical procedures are done elsewhere. We have been doing urgent care for probably about 16 months now. It's a little over a year. We've been at this present office probably about 2.5 to 3 years. This used to be the Voorhees office. Our main office is in Center City, Pennsylvania, as are the business offices and our administrative offices. We have satellite offices located throughout the Delaware Valley. We have several in southern New Jersey. We have several in the Pennsylvania suburbs. We have several also along the northeast corridor up into the Ben Salem area where we have our Rothman Specialty Hospital, which is one of our key centers where we do several of our orthopedic surgeries. I think first and foremost we have an excellent set of physicians. Most of our physicians are, if not nationally known, then certainly regionally known. We have some that are even internationally known. We are some of the leaders in terms of research, so we actually are involved in research in the particular area of orthopedics or sports medicine that we practice in. We are very much involved in the community. We take care of several of our teams, be they pro, Olympic, college, or even more so local at the high school level, which keeps us in the community so that we are able to relate to our patients not only as patients but also as people. I think for us it means that we are not only on the cutting edge when it comes to medical care, but we're also on the cutting edge in terms of discovering some of the newer treatments through research and through our clinical trials that we do. That puts us not as just practicing clinicians, but also as researchers and developers of new medical techniques. The Rothman Institute is involved in many different areas, and I'm sure I'm not going to get them all, but we have experts in sports medicine, concussion management, oncology, pretty much every orthopedic surgery that's practiced, foot and ankle, hand, shoulder, knee, elbow, hip, as well as general trauma and fracture care. Are very much experts in terms of pain management with our PM&R group. We are all part of the Rothman Institute. Each individual surgeon has their own particular surgical center and/or hospital that they report to, depending on day of the week. I should say we're very proud of our Rothman Specialty Hospital. We really worked hard, both the administration and staff of the specialty hospital, as well as the physicians, to make it a facility that is above all others in terms of orthopedic care. That is located across from the Parks Casino up in Ben Salem. We have patients who do stay overnight, for example, after knee replacement. We have facilities where people stay overnight, private rooms. It's a beautiful facility. In fact, my own father had his knee replaced there and had an excellent outcome, excellent experience, and I would say that even if I didn't work for Rothman.
Good.
I would also say that another thing that makes us an institute is our diversity in terms of what we take care of. The new concussion center down in the Navy Yard is a perfect example. The new concussion center is an alignment between the Rothman Institute, Thomas Jefferson University Hospital, and Wellesley Eye Hospital at present, and the coordination of care in the concussion center is second to none here in the Delaware Valley. We are able to pretty much provide, from moment of injury to moment of return to play, care along all aspects of the varying symptomatologies that we see in concussion, and certainly that's a topic that's on everybody's mind as we are here in football season.